Hey, it's time for another episode of Drive and Chat. I told you guys that I would talk a little bit on healthcare. What a disaster that is. If you go back and you do any kind of research on healthcare, maybe you go back to maybe 60s, somewhere in the 50s, 60s, somewhere in there. Uh, it was actually not that bad, right? It wasn't that bad. It was, prices, medications, whatever, prescriptions, procedures, doctor visits, things like that. It was actually not that bad. And the 70s rolled around. You had Nixon and those jokers in office, and they started messing with the system, right? Freaking idiots. And once they did that, and money got involved, right? Because really, if you go back and look at your history books, Nixon took us off of the gold standard, right? So we no longer, had to actually have something tangible, gold, to support the dollar, you know. So as soon as you do that, you can just start printing. Like, just start printing money. Woohoo! And that's what they did. So in that now it was money, money, money. And so the healthcare system followed suit, right? Really, honestly, it wasn't your doctors and nurses, hospitals, things like that. It was the insurance companies that followed suit. They started going for the money. Uh, and then it just got worse, and it got worse, and it got worse. And you can go and you can research this as well, is that, uh, you know, I would say the number one reason for bankruptcy in America, but it's right up there, man. It's like in the top five is medical bills, right? Will absolutely bankrupt a family, an individual, whoever. And so, and the politicians don't think this is the problem. They're like, oh, they should have saved up. They should have saved up. Uh, but no. So if you really listen to I think like Bernie Sanders and people like that, they they're telling the American people, the best plan for healthcare, you know. And so you can look at any, established country out there and see how they're doing their healthcare system. And it works, right? People get their healthcare, they're not going bankrupt. Um, and so why on earth do we continue to go down this dysfunctional road of allowing the insurance companies carte blanche? I love that word. So carte blanche means that they can just do whatever, and there's really no regulation, right? Now they do, they pull them up there. They get up on the hill, and they just grill them, right? Mm-hmm. But nothing ever changes. I mean, they admit it. They're like, nothing says we can't. So anytime they try to pass a bill to really kind of start restricting these insurance companies and these drug makers, um, it never passes because Republicans say no. So you're for bankruptcy, you know, crushing the American dream, right? Just because you had to have a liver replaced or pancreas or who knows, whatever, or you got cancer. Uh, yeah, they're for that though. They're like, hey, just deal with it. So who are they for? They're not for the people. That's for sure. Uh, they are for the drug makers. They're the insurance companies because they want to keep that machine running, right? Because more than likely, uh, they're getting funding. This is where it all. This is where the rubber hits the road, right? Is that you can go and you can find this if you dig deep enough to where the politicians get some of their money from, right? And everybody has interest groups and things like that, but that black money, that dark, deep, dark money comes from insurance companies, drug makers. That's where they get their. That's where the pockets they fill them pockets up, right? And so that's the why they vote the way they vote because they like that money flow. So you know how the old one scratches one back in turn scratches the other's back, that kind of thing, right? That's how it works, man. Yeah, check it out. All right, later.